everybody, so. Thank you, Ben. Have fun.
Thank
Thanks,
you.
Ben.
I've been.
No, you're good. Just
Trying to make sure you got
Do you mind if I start real quick?
Go right
So is it safe to assume? I saw like, what I'm trying to do is get the notes into Lao and everything.
Sure.
Everything moving from 1159 to 1161, like in terms of salaries, is it kind of like a 1-for-1 basically? Like, I see like 1161 is. Yeah, so like right now, 1161 salaries, 261K goes up to 873. Is that with additionals this year plus anything getting moved 115961?
Yes. Yes.
Yeah, the health officer moved to that, and then, our public health nurses, we moved from
Okay.
1159 to 1160.
Because that'll include additionals throughout the year as well. So I'm trying to just get everything note wise into Lao so that
Okay.
when we bring it up during the budget hearings that we can kind of flush that out, make it go a little bit faster.
Got you.
Okay.
Yeah.
So
Yeah, I
there's
think the
our,
health officer we moved over already, so it's really the addition of the public health nurses also.
okay.
Not just with the.
And yeah, there's like, you'll see in 1159, the benefits go down and they go up in 1161. So I was kind of figuring it was a one for
It's a
one.
one
there.
for one.
This doesn't show here.
Yeah, I'm gonna go through and put additionals in there as well.
Got you.
Okay.
That was the only question I had. Do you guys want to start then, or?
Yeah. Councilman Bozak, Councilman Stone, do you
Yeah.
just want us to go through?
Okay, go through, ask questions, I'll ask what's this budget for, who supports it, how's it, just so I get a better idea.
Sure, no, absolutely. So just start on that first page and we'll go through. Is that what, okay, so this first page is our levy fund. And this is also, of course, where all of our revenue comes into. And we did move, so we had moved the health officer when we, went to the full-time position and increased the salary. Earlier this year, and so we are moving over the nurses with the exception of the nursing director. And that is just because, the levy fund staying the same or even it's decreased a little bit and kind of stayed the same. We have had several situations with the state where legislation is passed that we can't charge fees that we could charge in the past, like on the fees and environmental side, so that's actually less revenue. And so we're just kind of trying to account for, increase in wages with the wage study and COLA increases for the last couple of years, and then some of that decrease of revenue into there because of some of those things we aren't able to charge. And so we knew that we needed to move some salaries over that. So that's what we did there. And that kind of takes care of the whole personnel section. Office supplies and that, all of those things remain the same in the supplies. Anything that changed from last year? We had those two legacy funds, so the 1168 and the 1206. That's the monies that we used to get from the state, and those we stopped getting in 2024. We had carryover from a few years. We still are gonna have some monies in there for next year. Instead of appropriating them to all the different line items like we've done in the past, they want us to get those spent down. So we put them into single line items so that we will use those first and get rid of them. So we moved training and ed from 1168, what used to be into there, into our 1159. And it looks
And
like,
the phones from 1160.
oh, same thing with our hotspots. Those are mobile hotspots that we use for all of our external units. So they were moved over, and then everything else is the same as what we requested last year.
Other services or each.
Oh, we moved that. We were paying it out of another supplies line item, and that didn't make sense to me. So we moved that down to other services. Nine, okay, just want to make sure.
Nope.
Are you good, Councilman Bozak?
I'm listening.
I just want to make sure, if you got any questions about 1159. So then the next
Yes,
are 1161, and that is the Health First Indiana, the local public health services fund. So we talked about the changes in the personnel services at the top.
This, what we discussed before. money.
Yes, yes. If we go down to supplies, the office supplies in here, the reason that you see that increase is we needed to purchase certificate paper. What we do our work with death certificates on is specific, it can't be duplicated and copied, and it has the watermark. It's very expensive. And we were able to, because we also have to have some reserve for where we have to put some of it offsite for vital record services at any time. We would like to be able to buy quite a bit so that we can have that available, and because the price can increase as well. So that was what we did there, or what we're requesting there. And then in medical and dental supplies, we have that increase. We've had several vaccines, especially our travel vaccines, that have increased quite a bit. That always kind of fluctuates, but a lot of those, even the manufacturer that we typically get, will go away. We can't order that, and then what we can order is quite a bit more. And then down in other services and charges, we have the travel that moved from the legacy funding. You'll see that we moved those hotspots for our general equipment out of here and into 1159 that we just talked about, and kept just the vital records ones in this fund.
The travel, which legacy fund was that moved from?
Oh,
Was it
I just put legacy funding, that was a very smart.
1168? No, I'm just trying to. It was 1168, what was the other one that you?
1206.
Okay,
It must have been 1206 where that moved from.
thank you.
Came from 1168.
Sorry, I lied, it came from 1168.
No worries.
Down, so liability insurance, that's something that is added. So currently, we do not carry any additional liability or malpractice insurance. And so with the new health officer coming on full-time and potential offering clinical services, we will need to offer that or carry that for them, and possibly at least one of the other nurses. And as far as that, we've not gotten a quote, so we kind of looked up in general for public health departments and kind of put in an amount, so.
and Carrie, what's that number? I don't have the papers in front of me. What's the number of your budget?
$12,000 for liability insurance. for that
Thank
year.
you. That's what I was wondering. Thank you.
We should have emailed you the form. I apologize.
I'm not upset. I'm listening and learning.
And then as you'll see, there's quite a bit of decrease in the maintenance agreements. That was where we had budgeted for that hardship for the food, for the environmental side last year, and now that is one of the distribution line items. So that's
Oh,
why
okay,
that
yeah.
dropped so much. So the contractual services, that big increase is the 10% capital that was set aside for the remodel being appropriated for paying those contracts. Any questions on those services and charges? Did increase furnitures and fixtures for the new space. We are not planning to get all new furniture. We just didn't realize how expensive furniture was. So we're kind of just going around taking, stock of what's going to be needed. Yeah. And then for data processing equipment, those are our agreements for software and different things that we have. And then our environmental division will be getting new Surface Pros this year. They're remote. They have the little tablets and they're at the end of can't update anymore. And so then below that are all the distributions in the areas that we have developed. And then the partnership that's affiliated or the types of programming out of that line item.
So it was one.
Sure.
In 2024 was 703 and 2025 budget will be 1.3.
Yes,
And that's distributions for all like the
all of our contracts and all
programs. Do you guys have?
programs that we're operating out. If you look at that other sheet too, that has the grade, it breaks it down by each line item that we set up for it. It's on the second.
That's,
under the third.
we assign like project IDs for those distributions so that it's all in their budget. It's, yeah, right here.
On the back of the first page.
And then- Yeah,
So in 2024, because we had not completed our needs
Right.
assessment, we didn't know, we put them all in the distributions and then we developed the line items or the projects as we went. And then this year, we were kind of able to see the full picture and get those kind of buttoned down and
We could probably look in this one, so you could send it out.
Yeah. absolutely.
So Andy can get a.
Yeah, that's what I was,
copy of
I
that.
was just thinking, I was trying to remember Andy had his own Porter Co email or.
but these, just so everybody's on the same page, these are the programs and what we've allocated for each of the programs that are addressing the needs based upon what you found with your needs assessment.
Exactly,
Gotcha,
yes,
okay.
yes.
Cool. No, that's an easy way to remember. Are you still in the process of doing the needs assessment stuff or?
The needs assessment things are done for 2024. We kind of wanted to see what ideas people had and what were out there, and we've received partner proposals, and we still have a few that are out that we're working with people on. For 2025, because what we've decided, and it takes a while, so a lot of the programming, even programs that the board approved in March, and then we put out for our 30-day notification, some of them haven't gotten to start, so it depends on, for example, Purdue Extension.
Mhm.
So they're one of our partners. I think that was the May meeting, or maybe even April. We had something to them in May, but it takes so long. to
Right,
get through
right.
Some of
Yeah,
their
it's a process, and then I
processes,
know
and
the
so by
board.
the time you
Right.
decide it. So once programs kick off, we're giving everything a calendar year. So from the time they kick off, and then we're reassessing everything. And not just that, but in the meantime, Chris has to get data from everybody every year. And, we have had to say, we have to get the data. If we're not getting the data on a time in there, that's part of the agreement. And so we are getting that data, and if we aren't seeing any movement of the needle, then we would talk about things even sooner. It's gonna be a situation of quality improvement.
Right,
constantly.
and like each of them are like what the SB4, like each of these addresses one of
Yes.
those, okay.
Yeah.
Okay.
Yeah,
And is there like, are you guys are holding back funds for future programs or like, so if one comes in, does another one go or?
yeah, that's what I started to say. So the funding is increased for 2025, and when we get to, we have county level KPIs that we have to submit to the state by December the 1st.
Okay,
And at that point, then we will look at everything that we have in place. And then are there any gaps? And for 2025, what we're going to do is put out a different kind of RFP. So we will specifically put out an RFP.
Based on our needs.
Yeah, based on our needs. And say that we were looking for somebody to put together a program for trauma and injury prevention in the area of drowning prevention. I'm making this up. And we have up to $30,000 available, so that we can make sure that we're filling the gaps
Right.
and addressing everything.
and that goes to the board, correct, too?
Yes.
Okay,
Yeah,
okay.
yeah,
so
so then we would put
that's-
that out and then.
Okay,
on it.
Yeah, I'm trying to think too, in terms of like covering our bases for future audits as well.
Sure.
I mean, I know you guys are gonna get plenty audited as well, just trying to,
Yeah.
and the board really helps with that, so.
Yeah.
Do you guys have like additional meetings, like this fund versus this fund, or are they all kind of the same meeting? I just look at it from a business point, I always see like from the levy fund, and this is just something I was just picking out, not picking on lawyers, but we have $35,000 for legal, $25,000 for legal on this one. I don't understand why we spend $60,000 on lawyers if it's, I mean,
So we have a lot of things that they've asked to review. So what it is he has a contract and that gets paid and then there's an hourly rate. And so typically in a typical year, he bills us until we run out and then he doesn't get paid anymore for the rest of the year. And so because of these extra agreements that Chris is writing and we're entering into with people, that's why we added the
got you,
additional
we call it
monies for
different.
hourly, yes.
Mhm.
But
He's reviewing them all.
But it's not just that. There are a lot of, there are a lot of things that happen that we have to notify him of and move him in, and he has to be part of the conversation and help us to navigate. I talk to him very
Yeah. A question with the distributions going forward to so it looks like we do have some like back and forth with other county departments.
Yes.
In some of our other budget meetings, we've spoken to, like juvenile detention services and the courts. And we kind of saw a little bit of overlap in terms of like where they need 2 PHNs or something like that. Is there like room, like with your board that they could come in front of you and bring that to your attention? Because what we've kind of noticed is we could do a little bit better job, like putting 2 parties together. Does that make sense? Like,
Yeah,
So-
absolutely.
if JDC needs 2 PHNs. I mean,
LPNs.
or LPNs, yeah, LPNs. Like, is that something that we can kind of start coordinating with you guys, or is that?
Yes.
We've already had a number of discussions with the JDC specifically, and regarding their nursing, and then also regarding their programming, because there are a couple of different areas where, we both groups feel that we could help each other. They felt strongly about having their LPN, be specific to the JDC and, well, it was one RN in the past, or however they have, chosen to staff it now. I talked to them about, processes. I know that's not a money thing, but I talked to them about processes and, how they're, kind of run as far as medical directorship, or whether those things or whether we can help with that, the health department, or the health officer or someone if they're having medical oversight, those kind of issues. But then, they had some other programs that they were really interested in, expanding, that I think our funding couldn't help with. And we have a meeting that's coming up, next week, with the JDC, and I think the council, whoever on the council was interested in coming, they were invited.
Proposal, yeah.
So, part of it is, working with the Board of Health to make sure that what they're proposing, the board feels fits with the Health First Indiana requirements. Because we have had to turn down a couple of proposals that our response was like, well, how are we gonna get any improvement data based on what you're asking us for? One of our board members is hesitant to just fund an employee. Because then how do you gather data from that, whatever? We're talking with them, because I think that's even a possibility. I think the state is fine with us paying a salary. I think, we obviously are doing it. And that could be a beneficial thing. It's just a matter of getting the board to say, yeah, I think having, an additional employee, whether that be a teacher, whether that be a health educator, whether that be a mental health professional within the JDC, is, something that can be, we can gather metrics on and see positive improvement, yeah.
In regards to the meeting with JDC, Sylvia and I were invited along with that, we're liaison to that, and I'm liaison to you guys as well, to see if they would the idea was brought up to see how your money could help them with the kids and so on, so, then do the best we can with the money we have.
Yeah,
And that's one of the
absolutely.
things, and one of the things that the board always asks to the point of the proposal is when they are items that typically would be a budget line item, does the council know? If they ask, is this something that, and so that's one of the things that's always, brought up and the board always wants to know. So when we get a proposal and we get it like right before it has to go on the agenda, sometimes we have to be like, hey, this might not, we might need to talk about this a little bit first.
So
So.
we should be there, but so,
Yeah.
Perfect.
Oh,
Is-
great.
Yeah, and that's great because you're liaison to
both.
both
Yeah.
parties, yeah.
Is there, and again, I don't know if it's been talked about before I got in here, but it's, to me, is there a way, or would your Board of Health feel more comfortable if, like, say you did supply to LPNs, would it be better if they were your LPNs? Like, not just JDC, you get what I'm saying? Like,
Yeah,
would it be better if they were to where then you guys could use them and say your offices plus at JDC? I don't know.
yeah, so that is,
I
we
don't.
could talk about. Now, here's where you come into the
Liability.
nursing we do is public health nursing, right? So I apologize, I didn't mean to ask.
No,
No.
I have.
But
again, I have no
there
clue
are
on-
specific public health activities. And when we engage in public health nursing, we kind of have protection. You don't have those liabilities.
We fall under the general government liability, insurance.
So what specifically would make that different than say, is the action maybe someone getting hurt while at JDC be out of the realm of what is covered for your people?
No,
Can
it
we
would
do
be
that way?
more like.
It's
they
more
could sue for
malpractice issues. Right, so it's very specific health related, nurses and doctors, providing medical care as opposed to public health nursing activities.
And I'm sorry, to clarify, are you saying you can't use your funds to do that? Because either way, they would have to have liability insurance if they hired them themselves, correct?
They require them to carry their own. And I believe, I don't know if they get some kind of reimbursement. We were talking about that with. They may reimburse them, but they require them to carry their own policy. They don't carry a policy for anyone. And
Okay,
it's saying that,
So does the county reimburse you for that, or they just take it off their taxes?
I don't know.
As I understand it, the JDC, so there is this malpractice issue, which probably could be, it's not particularly expensive annually, I don't think, to cover a nurse for malpractice insurance. Part of their other concern is they really would like stability over there. They want their nurses to be known by the kids and to be trusted and whatever, and not have a lot of rotating crew. I mean, so we have, what, 6 full-time nurses now, 6, right? Including, yeah, so we have 6 full-time nurses here. If they had an extra 2 and we were just rotating responsibilities for them, that might be a little destabilizing for the.
Well, then it falls under like, so what department are they actually under at that point though, too? Are they underneath the oversight of the health department? Are they underneath the health department, of JDC? Right. Because like it would stand to reason that SB4 would have those limitations, especially as far as KPIs go. So basically any one of these programs for distributions, you have to have measurable key performance indicators, and you have to be able to report those for the funding.
Right.
So it would stand to reason that a nurse that fell underneath one of those distributions would probably have to fall underneath the oversight of the health department.
Yeah.
And you'd have to have some measurable KPIs in order for it to qualify.
They'd have to be doing, so if it was additional nursing hours that they had available to themselves, to the JDC, they could be doing, health education programming for those kids that are actually in the JDC, that kind of, there are things that could satisfy the Health First Indiana core services, I think, that could be provided as far as programming goes at the JDC. It would have to be addressed in that kind of manner though, right? That
Right.
we are providing programming for these kids, and this is how many kids we educated on these things, and, you know, those kind of, ways.
That's like the wrinkle in there, that's, you know, the next level that
Right.
from the outside looking in, that takes a little bit more wrapping our heads around. From our end, it's not just dollars and cents.
I can't just see dollars and cents.
Yeah.
Yeah.
Just shifting around, right? Yeah.
When will the meetings take place with you and JDC?
Not the 11th? I thought.
This month?
Yeah.
Yeah, next
September.
week, was it?
I think it's September the 11th at 12:30. Did I make
If not, you can,
that?
I have 12:30 on September
and that will
11th.
be where,
Is it here?
It's here. Yeah.
room 102.
Yeah.
Thank you.
Thank you.
Out of all the distributions, how many are getting are contractual as far as the dollar amount? Like out of the $1.6 million that's getting distributed, how many are like getting our contractual services getting? Not exactly, I mean, I was just curious.
So contractual as far as programming goes?
Yeah,
Or,
I mean, pick one.
because then we have contracts, you don't mean contracts as far as translation services?
No,
or
I think you're just talking about
Maintenance
distribution.
agreements.
correct?
Yeah, like
Just
the
for- okay.
distributions, Northwest Health Screening for
Mhm.
200,000. Are we doing them or just?
They're doing that.
They're doing that, that's what I'm asking.
Yeah.
Yep,
Right.
yep. So it looks like it's about,
So transportation, we're not doing that, somebody else is
Right,
doing that.
correct,
Okay.
correct.
Mhm.
yeah, part of that. So the PCACS,
I got it,
that's
right.
70 of that. The other things, they are us, schedule lift rides, and give bus tokens.
So like, and I know I've said it, and so the total amount that we're getting, or this will be the 2025 budget for this health fund for SB will be $3.4 million, 3.5, right?
When you round up?
I'm looking on, yeah,
Well,
3.9.
3.38 is what we're getting. The reason it's over that is because of the 10% from capital appropriated.
Gotcha.
Yeah. Around 350 that are contracts with outside people.
Do they give you like a number that you have to use for overheads? I'm just looking at like 1.3 for distributions and we're getting 3.4.
They do not.
I would think it would be,
We have to do a spend plan just only so that they can look and make sure that everything we're proposing meets a core service. And the 60-40 split,
Yeah.
where 60 to 100% has
Right.
that. So that's their first thing they look at. And then the second thing they look at is just to make sure that we're meeting a core service. And they do really look at them to make sure that that could actually meet the core service that we say. But it's just a spend plan and it's actually, it's really not,
And the 10% capital.
it's in 10% capital.
So this, you submitted this budget to the state already.
Yeah.
As far as the budgeting process goes and the council's involved, is there, so like really that would set you guys back if there was funds moved around in there? I guess like from the health department standpoint, your board approved this budget, correct?
Yes, the board approved.
So in the event that the council did any rearranging in that budget, is that prohibited from your, like,
not statutorily.
okay, I'm just like trying to,
No,
I see.
no, with this,
You would just have to
Yeah,
go
we
in front
just
of the
go
board and
in front of the
resubmit,
board.
so it's not like set in
It would be
stone.
no different than recycling. They
Right,
just spent
right,
$50
right,
to find land, and
right.
they said no. So she said, well, the politicians already approved that,
Mhm.
then politicians are not doing it, so.
And we can make changes with the state.
Okay.
As
it,
ongoing.
if I didn't have to do it.
Okay. Okay. Question, distribution zones or?
what do you think out of the 1.3 would be the total percentage of spent on mental health? I think the state legislature, and I know they just, I think in July adopted, where you can spend money on mental health, but, uh, uh, I think they missed a boat on this one. I know that E911 said all their calls, have been, they've seen an explosion in mental health related calls, children calls, and again, I didn't write the law, but, I think everybody knows where you stand on this. I think
Yeah.
I think we have a big problem out there, and I think it's a shame if we can't, and that's why when JDC is in front of me, saying some of the problems that they have, and I asked them how many, out of those kids, how many are Porter County kids? They're all our kids. So even the JDC, they're all our kids. It's one thing if it's the jail,
Yeah.
no offense, like I told them. Some of them, if you're 40, 50 years old and you're still going to jail, I mean, there comes a time where I'd much rather help kids than
Break the cycle.
than the jail, because that's where I think we have a better
Right.
opportunity.
Oh, yeah, our
to at
kids are our
least-
future.
At least do
Yeah.
something here. So
Yeah.
that's why I was passionate about, like, well, there's gotta be something with, the money that you guys are getting where you can blend services, help, do
Yeah.
something, give them a grant for a nurse, do something, because I mean,
Oh, yeah.
quite frankly, it's a shame that I'm sitting here on this side talking to JDC and they're talking about 150,000 mile van that they have, which we didn't know, some of the things and yeah, so, I'm sorry. I muted it. But again, that's our problem, definitely not your problem, but it's all of our problem at the end of the day, right? I
Absolutely.
mean,
Yes, and we have met with them and we are continuing to meet with them.
so it's not like I'm
Absolutely.
trying to, and I know every department head in county government, just like schools, their department, everybody, that say, this is my department, everybody boards, I get that, but at the end of the day, when you only have so much money, if we can do some things and shift some things to help another department, especially with kids, and half the kids in there have mental health problems, so that's why I was asking about, what percentage you think out of the $1.3 million for distributions that we're spending on some type of mental health in Porter
And
County.
last year when we were before you, we had been told, of course, you can work in and through your other core services, substance use disorder, or trauma. However, they're allowing us to use it for mental health. And so we have reached out to both, Purdue Northwest and Valparaiso, their licensed clinical social worker program, as far as if we could, do some kind of partnership that way, because we are open to lots of things, but shortage of providers is the hugest problem, right?
Is there a percentage that the
So-
state requires you to use for mental health?
No.
Or there is no.
No, they just
No.
say you
No.
may use it.
Yeah, the money has, other than those core services, the 60, 40 to 10%, it's not, we are supposed to do a needs assessment, which we did,
Right.
a strategic plan and use it to best meet the needs of our county.
So do you have any idea when and or if you might come up with something like that, as to give us some idea in regards to how much is actually going to mental health?
Yeah, we absolutely can. I mean, I know that we have, the monies for Doc Shelby. We have, I know Sam's, initiative. Helps
So
with
the
the wraparound
reentry.
services for that, so the reentry for that. We have a lot of money towards student health, and we have just recently hired our, new school health liaison. And so she's in the process of, she has her letters to introduce herself to the school. And that's always hard because you don't want to seem like you're trying to, of course, bully your way in, and we know all the schools are gonna have different needs too. But basically, whatever they need. Within, reason that we can do, we really want to be able to do that.
The school health liaison there, RN or OPM?
She's actually a teacher.
A teacher.
Master's degree in education, curriculum and instruction. So we came before you guys to rewrite that job description, just because we realized that administrators, we kind of had Jess as such a great liaison between the school nurses and our nursing staff, but the administrator and teacher supports, social worker supports within the school, that we really kind of thought that we could be more additionally effective in that way. So
we continue to work with the recovery houses, trying to find a way of, that we can help them that falls, that meets the state's criteria and that the board is happy with, that we really would like to work with them. It's been a little bit challenging to find the right programming that we can help them with.
Thank you.
Carrie, she's one of our employees, and so it's not seen on here as a service or one of the distribution line items, but that care coordinator position, she has a lot of, she receives and phone calls from, visits from, a lot of our community and excellent services as well. So she's a huge resource of.
The Luna language services, that's a,
Translation service.
and you see more of a need for that. Are we getting that many
Yes. So
individuals?
Luna, our Luna contract is for written translation of documentation.
Okay.
But our big need is for video and voice translation. And we were struggling to find someone, but we actually had a meeting today with Bruce Lingo. And they're, well, today we met with Allen County. We met with Bruce Lingo, and then today we met with Allen County.
They've been using it for January. And they're very happy.
Extremely happy.
I'm just, well, I'm just looking at it.
Well, that's a lot for contract.
That's for the renovation.
Oh, yeah.
Okay, that whole 520, 520 is it?
This time is-
Wow. The
Yeah.
interpretation is
Okay, thank you for
crazy.
clearing that up for me, because I'm sitting there going, I think I'm gonna guess.
We'll hire you for like.
The only Spanish I know is where's the bathroom and how much? It's a, but for the bathroom, either way. Well, thank you for clearing that up for me. I can sleep at night now.
Any more questions on the distributions? That's an expiring, or,
Yeah, so 1168 and 1206. No more funds will be coming into those. They would like us to get them to zero and lose them. We're gonna do our very best. What we will do for the next year, we try to appropriately, line items we always appropriate in there, but that's very hard to do, stepping them down. As far as getting, when you have to pay something, we need to get it to zero. So what we did was put hourly, all of the money that's we believe will be left 1168 an hourly. And so we'll pay our hourly staff out of there until it's gone.
and
And
then,
then that will be gone.
well, then where's the hourly going up?
Oh, no, so then we have them, they'll go into 1161, which is all accounted for.
Budgets next year.
Actually, more than that, 'cause some of these grants are gonna go away too.
Yeah.
When are they ending?
They have already ended. We just have some funds left. And so we're finishing them out with supplies and,
Is that the two COVID ones?
yeah, the two COVID ones, yes, have ended.
And the,
Lead, those were the non-prescriptive funds that
The
were.
lead ones is-
Yeah, the lead has, and we just have a little bit left and it's not even on here.
Is that the
Oh, yeah, it
IIC?
is.
tobacco will have
To,
parts left next
yeah,
year.
tobacco, that will be done before the end of the year.
And bioterrorism responses, what's your fiscal is?
Yeah,
It's actually, we have two there now, so it's Jeff Pfeiffer and Jeff.
yeah, so our bioterrorism response grant fund will stay. Our health, IIC, that's our immunization grant, that will stay. And then our workforce development, the grant cycle has ended, but we still have funding in there to use the outdoor. Years.
You grants run a cycle, just out of curiosity.
Mm-hmm. Yes, and they run a July 1st through June 30th cycle, so that is so fun.
Makes budgeting.
It does.
Except for like we just had an asthma grant that was from May to August,
August,
so
yeah.
they're all.
An asthma grant?
Yeah, it was capacity building.
Capacity building, yeah, to get training for staff, to the those that have like in schools, not to do training for school. Well, we can start offering that also.
Any new grants on the horizon, or it's probably gonna be a full-time job managing the distributions of the, that's before pretty much, right?
Nothing new on the horizon at this time.
Some of the stuff we've seen come out recently are things where we can't apply, but they're asking us to partner, well, the whoever does apply has to partner with the local health department, and then they ask us to, so there was one that we just sent out to, the National Lake Shore and the state park, and Fort County Search and Rescue, because it was regarding drowning prevention. You had to partner with your local health department.
But BAM was probably a little bit limited with all the flurry of activity with the, with SB4, I would guess. You're still trying to get that all, the
Yeah,
ground figured out on that right now, so I could.
When, and I know I talked to you about this stuff, right, Gary? When does the state actually, because again, this was, SB4 was 2024, 2025, right?
yeah,
Initially,
just like anything at the state budget cycle, so they do 2-year budget.
okay,
Yeah, so they're going in to budget. The election in January, roughly, the budgetary session, yeah, so.
cool.
Okay.
It is through, June 30th, 2024. It will probably run. Yeah,
Once we're done with that, we'll
One.
turn to the one.
And then for anybody that, for those distributions, those are, on your website, they're all listed off, right?
All of our contracts. are posted.
And of the category, sorry, I'm forgetting what exactly you guys call it, but the different categories like access to care,
The
mental
core
health.
service.
oh, the person.
Core services, okay, those are all listed on there.
Yes, they
Okay,
are,
cool.
and
Yeah,
actually.
I just need to memorize those.
Nah.
Unfortunately.
Is there that many of them? Is there that many of them?
20.
Oh, there's 20 of them, okay. But basically, like, when you're looking at those, like, each one of those distributions is matched up to a core service.
Yeah.
Okay,
Or more than.
more than one.
One, yeah.
multiple.
Yeah, there's so many.
The KPI part is real interesting.
Yes,
That's it, because like, that's something to think about. Because that really throws kind of a weird wrinkle in it, where it's like, okay, you gotta be able to measure something.
right, that is really hard, we struggle with the halfway house in particular, we understand that you have to be clean to live there, and they have to test people to make sure that they're clean. If we pay for drug testing, there's nothing for us to measure, so how can we move this around? What can, what do you do that we can measure, and we can.
Do you see that as like one of the biggest challenges of, like, it's probably not hard then to find a category to fit it in, it's just determining KPIs that really.
Yeah, determining how to.
I would
capture the
say,
data.
yeah, how to make sure your program can institute meaningful, measurable change.
not that it's impossible, it's a challenge, yeah.
Right.
That's just the one that, you know, from our end, it helps to have that background and that education. Just knowing, okay, these are the things from your end that you kind of gotta have sharp there. So,
And we are thankful that the state leaves it up to us, like we develop our own KPIs. What are we going to measure out of this? That helps. They're not laying something.
yeah,
completely
yeah,
on
like one of
us
these
for each
KPIs,
of the-
right? But still, I mean, it's not easy. Sometimes it's harder to come up with your.
Oh, I did, and they have to be Smarty, like, and so that's difficult too, so you write a Smarty goal, then you have to make it a KPI. Now, the nice thing is our KPI isn't by the end of 2025, it's something like by 2027.
Right,
Decrease the obesity by 3% or something like that, and
that's cool.
so I would really worry about that. Having to come up with what we're gonna measure
Quickly,
in 1 year, you know?
Councilman Bozick, do you have anything?
I'm having trouble unmuting. Can you hear me now?
Yes.
Yes, Andrew,
Hello, Councilman. No, I think I was pretty clear. I just want, the one thing that brought was caught my attention at the beginning. You were talking about salaries. You talked about the payroll study we had did. Are you giving your employees increases this year, or is that just, I mean, you're just following our, whatever we do for our employees, or not our employees,
I've
but the
been
county?
talking historically,
Okay, thank you.
yes. We actually, during the pandemic, got infusions into our 1159 that we don't normally get, which is how we've been able to sustain salaries and things. So,
Okay, thank you for clarifying. I just want to make sure.
yes, I apologize for that.
Sure.
pretty clear. So they said it's scared me with that.
Very expensive.
Let me check it out. We were very
I
excited.
didn't know if you were flying the guy in with water.
Yeah,
Same
he
thing.
comes up about every other
Commuting
week.
back and forth, yeah.
Be surprised, there's some really challenging like language ones though, like where it's like a very rarely spoken language.
You
What,
look,
And
what one did Allen County keep talking about today? I had never heard of.
Chin, Burmese,
Yeah, they have a lot of those.
yeah.
you can also get some from southern Mexico that don't speak Spanish, they speak it in dialect.
Oh, yeah.
And it's not very, my ancestral background, back in the state, from the Zapotec area, which is southern Mexico. They speak more Indian. A good example in Spanish, the word pavo is turkey. I grew up knowing it as guajolote, not even close. So what I spoke when I was little was Chichimeca Indian and not
Wow.
Spanish. So I don't
Yeah.
speak Spanish, I speak Indian.
So interesting.
Yeah.
Yeah, don't call me, it's been a long time. I'm happy to say, is your mother still cross-eyed? And the question and the answer was supposed to be, hi, do you need help?
is there anything else you have for us or? We'll just wrap it up.
First reading.
First reading is, yeah, that's,
23rd.
first reading is the 10th.
Oh,
First reading is real quick. It's more of the kicking the whole process off.
Okay,
So you could be there if you want, it'll be quick, but first reading.
and then,
It's just Ryan and I reading off a bunch of numbers real quick.
okay, and then the schedule that we got is what it is, Monday nights and Friday nights, so we're Friday night, okay, just want to make sure.
and we look interested.
Hey, Dave and Ryan, I want to remind you guys, I will not be there for first reading. I'm out of town for work.
Okay, yeah, that sounds good.
Yep.
It'll be pretty quick, but, yeah, we're hoping maybe we share it online if possible, but
It's good again.
I'm gonna turn, recording off then.